Imagine discovering that your child has neurofibromatosis, a silent and little-known disease. Would you know what to do? Neurofibromatosis can strike anyone at any time. Recognizing early signs of neurofibromatosis can make all the difference in diagnosis and treatment. Learn about this genetic condition, including everything from its definition to symptoms, diagnosis, and treatment options. In this video, you will find everything you need to know to identify and deal with neurofibromatosis effectively. And if you're not yet subscribed, subscribe to the channel and activate the bell so you don't miss any content. Watch this video and you will be surprised at the end. So what is neurofibromatosis? It is a genetic disease that causes tumors to grow along nerves in the body. These tumors, usually benign, can appear anywhere in the nervous system, including the brain, spinal cord, and peripheral nerves. The disease is divided into three main types: neurofibromatosis type 1, neurofibromatosis type 2, and schwannomatosis, each with specific characteristics and distinct inheritance patterns. How common is neurofibromatosis in society? The prevalence varies depending on the type. Type 1 is the most common, occurring in approximately 1 in every 3,000 births. Type 2 is less common, with an incidence of about 1 in 25,000 births. These statistics show that although not extremely common, neurofibromatosis affects a significant number of people. What are the associated risk factors? The main cause of neurofibromatosis is a genetic mutation that can be inherited or occur spontaneously. In the case of types 1 and 2, there is a 50% chance that an affected parent will pass the mutation on to their children. Schwannomatosis is generally not hereditary and is caused by sporadic mutations. There are no known environmental factors that increase the risk of developing the disease. What are the initial and most common symptoms? For type 1, café au lait spots on the skin are often the first symptoms, along with cutaneous neurofibromas and Lisch nodules, which are small tumors in the eye. In type 2, the most common symptoms include hearing loss, tinnitus, and balance problems due to vestibular tumors. In schwannomatosis, severe pain caused by schwannomas is the predominant symptom. Symptoms may begin in childhood or adolescence, depending on the type of neurofibromatosis. If you are enjoying this content, leave a like and comment below what you find most interesting. Don't leave the video now, as we still have more amazing content for you. How is the diagnosis made? The diagnosis of neurofibromatosis is based on clinical criteria, imaging exams, and genetic tests. For type 1, a doctor can identify the disease if the person has 2 or more characteristic signs, such as café au lait spots or neurofibromas. In type 2, MRI is essential to detect schwannomas. Genetic tests can confirm specific mutations associated with each type of disease, helping to establish an accurate diagnosis. How is the treatment carried out? Although there is no cure for neurofibromatosis, treatment focuses on managing symptoms and complications. Options include surgery to remove tumors, physical therapy, medications to control pain, and regular monitoring to detect new growths or neurological changes. In some cases, experimental therapies and targeted drug treatments are being investigated as potential treatment options. And tell me in the comments, what theme would you like to see in the next videos? Thank you very much for watching this far.